Hi, everyone. My name is Dr. Ann Auburn, and I'm the owner and founder of the Natural Health Improvement Center in Grandville, Michigan. Tonight, I'm here to talk to you about healthy tips for living pain free. We all know that if we've ever had an injury, or if we're getting a little bit older, or if we have a chronic disease, we might have increased pain, sometimes a little, sometimes a lot. So let's talk about how we might be able to help you fix that or improve that significantly. The objectives for today's lecture are defining what pain is, what types of pain, as in acute versus chronic, what are some of the underlying causes of pain, how do foods cause inflammation and pain, what does gut health have to do with pain, and the various therapies for pain management, some of which we offer here at the Natural Health Improvement Center. Prolotherapy and PRP regenerative injections, medical ozone treatments, including injections, IVs, etc. HBOT, which is hyperbaric oxygen therapy. HOCAT, which is our hyperthermic ozone carbonic acid transdermal therapy. And nutritional supplements, as well as acupuncture and other therapies that we might send a patient for. What we can do for pain. So, what is pain? Pain is a signal that something's gone wrong. It's trying to tell your body, like, you have to fix something, change something, do something differently. That signal can tell you that there has been an injury or that an injury is about to occur. Now, sometimes the pain lasts a long time and it doesn't kind of make sense because the injury is gone, but yet the pain is still there. So that gets into chronic pain, and we'll talk about that a little bit too. Now, pain can present in lots of different ways. You can have fibromyalgia, that's more of a connective tissue kind of pain, a muscle type of pain that's really chronic. There's also joint pain, arthritis, and there's just plain old muscle pain from straining a muscle or something like that. That's called myalgia. You can have pain in the back, pain in the neck. You can have headaches, and headaches have many different causes. Just muscle tension, could be sinus congestion or allergies, migraines, facial pain from like TMJ disorder or your teeth not working correctly or some problem in the mouth or in the muscles of the face or head. Also, there's nerve pain. Nerve pain is like a problem all its own and it has special features. And then there's post COVID pain. We had a few patients with this, and there's things that definitely can be done for that. And then there's the stealth infections. We call them stealth because they're kind of there, they're hiding, they're not clearly, depicted in a person's symptoms, but we have tests to sort out if that might be part of the problem. Also, chronic fatigue immune deficiency syndrome. This is sort of a special situation. It usually has fibromyalgia as part of it, but it also has other things creating the immune deficiency. It's not just usually inherent in the person. Something has happened to sort of turn this on, some kind of biotoxin or mold in their environment or something else, and we can sort through that as well. And then there's autoimmune disease. These are things like rheumatoid arthritis or lupus. We've had several patients come through that have multiple autoimmune diseases, and we usually can help them. And then you have pain from organs. Some examples would be like heartburn, that's stomach pain, or reflux, that's the pain that goes up into the esophagus when you get that stomach contents refluxing upward. Irritable bowel pain, so that could be cramps, discomfort. Also, colitis. Colitis is more an inflammation of the lining of the gut. There's a couple different types. And then there's just things like menstrual cramps, or you can have another type of thing would be gallbladder pain. Gallbladder pain has a very specific area that it's in, and it radiates to a certain area of the body. So those are some types of organ pains. So commonly reported pain conditions are mostly musculoskeletal. The National Institute of Health Statistics survey shows that low back pain was the most common at 27%. And then there's severe headache or migraine pain, that's about 15%, right there along with neck pain, 15%. And then there's facial aches or pains, those are about 4%. So back pain is the leading cause of disability in Americans, especially those under 45 years old. More than 26 million Americans between the ages of 20 and 64 will experience frequent back pain. And I can tell you, with the prolotherapy and PRP injections we do, I am always amazed at the improvement we can see in these chronic types of musculoskeletal pain. So we'll talk about that more later. So acute pain is short term. This is when the pain is less than 12 weeks duration, especially when kind of it just happened, but this can go on for a few weeks. Let's say you sprain your ankle or something like that. Usually that will heal up in 6 to 8 weeks, but it depends how bad it is and if you've had injuries before, that sort of thing. Other examples would be like post-surgical pain or pain from kidney stones or childbirth, things like that. Then you get into chronic pain. Chronic pain is pain that lasts greater than 3 months or 12 weeks. These pain signals can keep firing in the nervous system for weeks to years in chronic pain. The initial injury pain's gone. There's nothing, crushing any kind of structures or anything like that anymore. Although you can have nerve pain from a nerve that's being compressed by arthritis or a bulging disc or something like that. But a lot of times in chronic pain, the initial injury pain is gone, but this recording of the pain or the messages about the pain from the brain just keeps continuing. So, we're going to talk a little bit about why that might happen. And so this is where we kind of get into what is the underlying pain generator? What is the root cause? How can we help to get this underlying pain generator under control? So chronic pain, when you look at it, it's kind of like an iceberg. If you look at the picture there, the iceberg, we only see just a little bit of it above the water, and 75 or 80% of it is actually below the water. And that's often the case in chronic pain. There's like the pain, your foot or your leg or your back or your neck or your head, whatever the case may be. But that is just scratching the surface. You don't really know that the pain generator is right there. Maybe it's something more systemic, like a food you're eating or some kind of gastrointestinal problem you don't really know that you have. Or maybe it's ligaments or tendons that are supposed to be stabilizing that area that aren't working right. So just saying, hey, I have back pain, that's a diagnosis. It's sort of a description of a symptom, but there's many other things that could be going on. So a lot of the treatments out there will only treat the tip of the iceberg, the pain in the neck or the pain in the low back. And sometimes those treatments, injections at the pain clinic or something like that, they can be super helpful to kind of put out the fire. But if there is remaining pain, even after those things are explored, or if you have a situation where you're not really finding the pain generator on an X-ray or something like that, a lot of times these problems that are underlying aren't fixed. So let's look at what else we can do and what else we can investigate. So when you have pain and disability, you have to peel the onion. There's many layers that need to be treated to handle the causes of the problem. That's why when patients come here, we do ask them what they eat. We talk to them about clean eating things that aren't going to increase inflammation in the body. You've probably heard me, if you've ever seen me talk before or seen any of my other lectures, that we really want to reduce sugar intake in our diet because it's very, very pro-inflammatory. We'll talk about that a little bit more later. Now, there's lots of underlying causes. I've touched on a couple of these already, but let's just go down the list here. There's inflammation from a local source, like an ankle sprain, ligaments that are damaged or bruised or partially torn. And then there's distant sources, like the gut inflammation that I spoke about earlier, or inflammation from something you're eating. And then there's restricted motion. There's also joint hypermobility that some people have. There's loss of the normal function of the tissue involved. And then as part of that, it can be ligament laxity. It can be muscle imbalances. We also call those neuromuscular imbalances. And we really love our physical therapy friends that help us with our patients with that because they really get in there. The PTs that we use really know how to sort that out. And then there's hormone imbalances or deficiencies. We treat those in men, women, young and old. And then maybe mineral deficiencies. We can check a lot of these things in blood. There's maldigestion, malabsorption. You can see we're kind of getting to the deeper layers. And food and environmental allergies, those can increase inflammation as well. Impaired immunity or toxicity from things like, say, heavy metal toxins or mycotoxins from mold. Some people are sensitive to that. Or just toxins that may be in your food that aren't healthy for you that cause a little bit of inflammation in your gut or other areas in your body. And then there's leaky gut syndrome. We'll touch on that a little bit. We have an entirely other lecture on that I've done before. You can probably find it on YouTube or on our Facebook page. And then there are underlying infections that we mentioned earlier. So all of this is to say that what we really want to do is we want to take a multidisciplinary approach when we approach a patient. That usually means we can't do everything on one visit, but we can get to know the person, we can take their history, we can see how things go as we go through our treatments with them. And we're going to be thinking about all of these different pieces as we put this person's program together. And a multidisciplinary approach is going to be best to handle the deeper layers and get to the various causes of the problem so that we really handle the pain as best as we possibly can and really get you your maximum potential. When we talk about musculoskeletal pain, the majority of the time, the root cause of this continued chronic pain is ligament and tendon laxity and the associated neuromuscular imbalances with this problem. Musculoskeletal pain is due to the weakness of these connective tissues. Things move around more, they're not as stable, the muscles are working harder and harder to keep everything in place, to keep your balance, to keep your horizon level with your eyes, that sort of thing. So, according to the founder of prolotherapy, Dr. George S. Hackett, MD, he quotes the following. Ligament relaxation is a condition in which the strength of the ligament fibers has become impaired so that a stretching of the fibrous strands occurs when the ligament is submitted to a normal or less than normal tension. So, in other words, what he's saying is, let's say you go to throw a ball and it's something you've done hundreds of times and no problem, but that same stress, when the tendons and ligaments, those connective tissues, are injured or weak, it causes more pain with less stress. So there we have an incompetent structure, and we need to heal that with regenerative injections. So we'll talk about more about what that is in a minute. So ligament and tendon laxity causes pain, and then this leads to the neuromuscular imbalances. The body is trying to make it right. It's trying to keep it stable. It's sending new messages down there to handle this problem it's having. So when this happens, the normal symmetry of the body is lost. Some muscles are too tight, others are, too weak. They fatigue easily, and they don't work as well as they should. So that's what we call neuromuscular imbalances. These pictures depict ligament pain referral patterns that were discovered and written up by Dr. Hackett. You can see here that in the low back, there's sacroiliac ligaments, iliolumbar ligaments, lumbosacral ligaments, etc. Those will refer pain down into the leg, and a lot of people think that they have nerve pain, that they have a pinched nerve in their back, or their sciatic is compressed or something like that. And it's really coming from the weak ligaments. And I would include in there tendons, because there's a lot of muscles that have tendons that also stabilize the joints in that area. And on the right, you can see a picture of this in the upper body, the ligaments and tendons that go to the skull and then down to the cervical spine, the neck. They can refer pain patterns that are not from nerves, they're from ligaments and tendons that go down into the arm. At the time when Dr. Hackett did this, he was thinking more in terms of ligaments, so he calls these ligament pain referral patterns. These are examples of ligaments and tendons that you might find in the body. A very common area of pain is low back pain. You can see there's layers and layers of ligaments. There's ligaments that go from one bony structure to another. There's ligaments that stabilize the individual vertebrae. There's ligaments that go from the sacrum, the very bottom part of the spine, down to the pelvis, to your sit bones. All of these can be injected with regenerative injections, prolotherapy or PRP. And in the shoulder, there's two pictures there. You can see the ligaments in the picture that's black and white and kind of yellow. And then in the far right picture, the colorful picture, you can see the muscles that are kind of pinkish, and then their tendons are sort of blue, hooking up into the shoulder area and kind of blending in with some of the ligaments there. So both ligaments and tendons can cause this disability or instability of joints and can be injected with prolotherapy or PRP injections. So now we're going to talk about how foods can cause inflammation and pain. A lot of times we don't really think about what we eat as causing inflammation, but I've seen it over and over again, hundreds of times, that these things can add to the pain that we already have or make it worse. So inflammatory foods would be your foods like the unhealthy, sugary sodas and various drinks, your fried foods that are basically carbohydrates that are then fried and turned into bad fats that cause inflammation. Also, you've got your flours, your grains, they can also cause a lot of sugar levels to be higher in the body. They're digested very quickly and turn into sugar, which then can cause inflammation. Things like white potatoes, rice, things like that can do that too if you eat too much of them too much of the time. And then, of course, you've got your red meats. These meats do have arachidonic acid in them. It's not that you can never eat them, but the amount should be lesser than your fish and your chicken, your turkey, and things like that that have less of this. So these are high glycemic load foods that can, except for the meat, which is arachidonic acid, but things like high fructose corn syrup, if you ever see that on a label, you should just throw it out. It's the worst thing for your body. It causes inflammation, pain, and actually damage to your tissues. So these processed and refined foods and the Franken foods that are made by, GMO changes in the seeds and heavy processing, artificial ingredients, things to make them last longer on the shelf. They're all pro-inflammatory. Also a diet that's lacking protective fats, like your omega-3s from fish and omega-3s from other sources, nuts and whatnot. Those are anti-inflammatory, and if you're not eating enough of them, you're going to have more inflammation. And then also a diet that's just low in fruits and vegetables, lacking antioxidants. These things are, carrying the phytonutrients, the B vitamins, the things that help detox you, that are anti-cancer and anti-inflammatory. If your diet is deficient in these, you're just going to have more inflammation. And if you have food sensitivities, this is another whole area of inflammation from foods. So food allergies and sensitivities are a problem for some people, not everybody, but I've had patients come in thinking that they have arthritis all over their body, or they have fibromyalgia, or their headaches are just, their fate. And, we do these food sensitivity tests, take them off the foods that show up, and all of a sudden they don't have pain, they don't have headaches, they don't have as much sinus problems, they don't have as much fatigue, anxiety, or insomnia. It's pretty amazing. Sometimes it takes 2 or 3 months to see the full effects of this because your body has built up antibodies to these foods, giving a pain signal or an inflammation signal to the body. Many problem foods include gluten, dairy, eggs, and a lot of the grains and nuts often show up. But this is a totally individual thing. You have to do the test and see what comes up for you, and then change your diet and see what happens. We have a more in-depth on this in our previous patient education night called Natural Heart Health Strategies. And I also talk about this in our gastrointestinal health lectures. Sugar spikes are definitely a cause of inflammation. If you want to read more about this, there's a great book called Glucose Revolution. Jessie Inchauspé is a person who had back pain herself and was looking for ways to reduce her pain. And she found out if she ate foods that spiked her blood sugar after she ate, she had a lot more pain. And if she ate vegetables and protein before she ate those foods and ate less of those foods, she would have less pain. So she explains this whole idea of eating high fiber vegetables and protein before your carbs to flatten your glucose curves and reduce diseases that are associated with these high sugar spikes after you eat. It's a great technique for stabilizing blood sugars, losing weight, reducing your cholesterol, lowering the stress on your liver, and improving energy, cravings, pain, and inflammation. And she does a great job explaining it. We're talking about glucose spikes here, so let's look at the glycemic index here. Just a quick overview. You could spend hours reading about this, but eating foods low on the glycemic index really tend to reduce pain and inflammation and keep your blood sugar stable all day. And that just is totally equal to better health. So you can see glucose is what everything is compared to on the glycemic index. Glucose is 100. So look at there, white baked potatoes are 85% the same as just eating glucose. Table sugar is actually less than glucose. White bread is up above table sugar. In there you can see the green items there, sweet potatoes and apples, milk, green beans, et cetera, et cetera. Those are much lower on the glycemic index. They won't spike your sugar as much. They won't cause as much inflammation, and you're just going to be healthier and put years on your life. Let's now talk about bowel dysbiosis. This is not something that many people will relate to their overall pain, whether that be body pain or organ pain or chronic pain of some sort. But I'll explain it to you. Dys means bad, difficult, painful, disordered. Biosis means condition of life. When you have this bad condition in the bowels, it affects the entire body. So what happens is if you get an imbalance of the life forms in the digestive tract, that's the bowel, going from your mouth all the way down to your anus. If you have things like candida overgrowth or bacterial overgrowth or parasite overgrowth, then you have also maybe a lack of good bacteria down there. This will make the digestive environment out of balance. When it's out of balance, you have disease. This can cause inflammation. Those inflammation products can leak through the walls of the gut into the lymphatics, into the vasculature, and this can then create pain in other areas of the body. And it can go anywhere where you might have some kind of weak area, whether that's, joints or, headaches or heart or whatever. It can cause pain in these different areas. So overgrowth or lack of an item in the gut environment can create maldigestion, malabsorption, inflammation, immune system dysfunction, and lead to diseases, inflammation, pain, and pain in non-gastrointestinal tissues. We often refer to this kind of pain that goes beyond the gut but comes from the gut, leaky gut syndrome. The scientists that research this they call it intestinal permeability. Often when you have the overgrowth of some kind of species down there and you don't have enough of a certain good bacteria and there's a lot of inflammation down there, what happens is the walls of the colon start to get damaged. The cells are not as tightly packed as they usually are, kind of causing like a barrier, kind of like the skin on the outside of your body. This is the barrier on the inside of your body. And what will happen is these particles, that either inflammatory particles or tiny bits of totally allergic materials or other things, toxins, let's say, if those leak through the walls, the little tiny microscopic holes in the wall of the gut and get back into the bloodstream and the lymphatics again, this forces the liver to process higher quantities of internally and externally derived toxins. And this stress can lead to a heightened systemic inflammatory state. By calming gastrointestinal inflammation and supporting the repair of leaky gut syndrome, with nutritional supplements and dietary changes, this can help to calm the systemic inflammation and the inflammation in the non-gastrointestinal tissues like joints, lungs, skin, sinuses, whatever. This is just a picture comparing a healthy gut. You can see the side with all the good food and the nice pink gut, and the cells are, like I said, tightly packed together. There's good bacteria in there. And then on the other side, you can see the gut just isn't a very nice color. You can see it's like brought on by fast food, fried food, medicines, sugars, all the kinds of things that we talked about that can increase inflammation. And then you can see the leaky spaces in the gut wall there. The white stuff there is yeast overgrowth. This can increase inflammation, and this can cause problems in tissues outside the gut itself. The gut might not feel very, very good either, but we don't always have gut pain when we have this situation. It can manifest as just pain in other places. We know that inflammation is related to chronic disease. Basically, all disease states have some degree of inflammation. The question is, where is that inflammation coming from? Is it from a chronic infection? Is it from weak ligaments? Is it from a bad gut? We have to investigate that and find out, because inflammation is responsible for the pain and tissue destruction in patients with like rheumatoid arthritis, inflammatory bowel disease, chronic headaches, fibromyalgia, things like that. And it's been written up in magazines, just popular magazines like Time and other places. You can find all kinds of information about this on the internet too. Like I say, there are scientists that all they study is gastrointestinal inflammation or intestinal permeability and how it relates to the rest of the body. And this is a definite cause that we have to look at and see what we can change with our lifestyle. Toxins as a root of inflammation and disease are something we also look at here at the Natural Health Improvement Center. Things like heavy metals, they are a common source of neurotoxicity, inflammation, immune system dysfunction. And then when all of these things happen, then it can lead to things like the leaky gut we talked about, the candida overgrowth, or poor healing, poor immune function, things like that. Also, there's toxic substances that are in our environment: pesticides, herbicides, fungicides. These are higher than ever in our environment right now. That's why we promote doing a detox at least twice a year. Some people recommend doing this quarterly to get these toxins out of your body, because you can't feel them. They very slowly cause damage over time, and they're in our environment. Chemical fertilizers, factories, cars, trucks, planes emissions, fast foods, drugs sometimes that we actually need, for certain conditions, and then other habits that we have like alcohol and cigarettes, tobacco. Those all are putting toxins in our body, and we can change that with lifestyle changes and detoxification on a regular basis, which we can teach you how to do here at the clinic. Now, we have a lot of therapies to help pain management, so now let's talk about those. Prolotherapy and platelet-rich plasma injections I referred to a little bit earlier. Those are injections that are going to repair an incompetent structure like a ligament or tendon, and they are really more for musculoskeletal type of pain. There's two of them that we deal with here at the clinic: prolotherapy and PRP. Prolotherapy is where we make a solution of dextrose, we dilute it with a numbing agent, and then we put a homeopathic in it called Zeal, and that is going to help us to tell the body to heal itself. It's going to induce proliferation of new cells, and that's why we call it prolotherapy. We also refer to this as regenerative therapy. Regenerative therapy is a term that refers both to prolotherapy and any kind of injection like this that heals tissues. PRP is specifically platelet-rich plasma. It really is a type of prolotherapy, but with a different solution, with growth factors from your own blood to stimulate healing and repair, and we'll talk about that a little bit more later. So prolotherapy and platelet-rich plasma, why do they work? What are they actually doing? Well, blood flow is vital to the body's healing process. Ligaments and tendons have a naturally poor blood supply. If you've ever looked at like a chicken that you cut, the wing or the leg off or something like that, you'll see there are these white connective tissues, and they don't have a very good blood supply. So when they are damaged, there's incomplete healing, and that's just the norm of what happens. Your body kind of patches it up as best as it can, and then the ligaments and tendons just kind of make do with what they have. And this does lead to laxity, weakness, joint instability, and the neuromuscular imbalances and chronic pain that we talked about earlier. The first step to stimulate the healing process is inflammation. And I'll tell you more about that later, but Prolo and PRP injections, they gently start this process in the human body. I'd like to explain to you how prolotherapy and PRP actually do the healing. Prolo and PRP solutions are injected into ligaments and tendons, as well as near cartilage, to induce a localized inflammatory response at the site of injury or weakness. Inflammation is really the first step that's needed for any healing process in the body, and it signals healing by stimulating the proliferation of ligament, tendon, and cartilage tissue. That's why we call it proliferative therapy or regenerative therapy. It's a signal, it's giving a signal in the areas of injury and tells the body, hey, send new cells down there to heal this area. So, prolotherapy and PRP treat the most common cause of musculoskeletal pain, which is ligament and tendon laxity, and they support the healing of the other connective tissues like cartilage that are in the area. Now, here's an example where you might have seen this before so you can understand the healing process a little bit better. These are pictures of a cut in the skin and the healing process that it has gone through over several days. What happens is various types of precursor cells and new collagen secretion occur with regenerative injections, just like they do at this cut that you have in your skin. It pulls the wound together and stabilizes the connective tissue. And this occurs over and over and over again to approximate and repair the wound. Well, in the injections that we're talking about, regenerative injections, the body has just kind of forgotten that that tissue needs to be healed. It's gone off to do something else and hasn't completely healed it. So, what we're doing is we're telling the body, hey, send some more collagen down there, send some fibroblasts and macrophages, all these precursor cells that tell the tissue that it needs to be healed again, and tell the immune system and the nervous system to send those cells down there. So you can see it in your own skin if you've ever had a cut. It's the same process and it starts with inflammation. Now, here are some pictures of somebody who had PRP for an Achilles tendon tear. If you look at the picture that says before, you can see the arrow is pointing to this black area where the tendon is really damaged and mostly gone. There's a few little white fibers there holding it together, leaving a little bit of a scaffolding for the new cells to cling onto. Now, after 3 PRP injections that were done over a period of 2 to 3 months, if you look in the after picture, you can see there's more grayish, whitish tissue there. It's all filled in. There's basically a new Achilles tendon there. So this is remarkable, and it's seen over and over and over again in regenerative injection treatments. And there's lots of pictures like this on the internet, and I've had a few of my own over the years. So this sounds pretty miraculous, right? That these injections could do so much. But I always tell people it's worth a try. You know, if you're trying to avoid surgery, if you're trying to get out of chronic pain, if you're trying to get back to normal function, prolotherapy and PRP are very, very workable therapies and definitely worth trying, 3 to 6 injections. Here's a picture of me actually doing prolotherapy in a knee joint, and you can see the solution is clear there, so it's not PRP. Um, and it's quite easy. It's not that painful. You'll feel little pokes. Most people don't need any kind of anesthesia. Sometimes we will do a little bit of cold spray on the surface so you don't feel the poke as much. A knee, a shoulder, a low back. Most places that we do can be done in under 5 minutes. So it's not that long of a process either. And most patients do just fine. They might have some inflammation or stiffness afterwards, but nothing they would need more than like Tylenol for. And often, they don't even need that. Maybe some MSM or quercetin or some kind of natural anti-inflammatory. I myself have had several injections over the years for various parts of my body, and I've never taken even as much as a Tylenol. You might be wondering the indications or symptoms in a person who could benefit from the Prolo or PRP injections. It would be examples, a shoulder or hip pain that's causing trouble sleeping, joints that dislocate easily, joint pain that's worse with activity and better with rest. Adjustments, they'll help, but they might not last. You might have to go to your chiropractor or your osteopath over and over and over again. So those people could benefit from the injections. Grinding, popping, or clicking in a joint, those all can mean that you have instability. If you've used muscle relaxants, arthritis medication, cortisone shots, nerve blocks, things like this, and the pain just fails to go away within 6 to 8 weeks, then you might be a candidate. When surgery's failed, a lot of times the ligament and tendon laxity has not been addressed. Or if the joint pain is helped by a sling or a brace or some kind of support splint or something like that, then you might benefit. Diagnosed with ligament or tendon sprains or tears, having a deep aching or pulling pain in a joint, or shooting pain, sometimes tingling or numbness. Like I said earlier, this could be the ligament referral patterns. Of course, we would have to do a good exam and decide if this is something that really means you have a truly pinched nerve. Successful is prolotherapy and PRP. They are very successful, at least 70 to 90% in the literature. This technique can strengthen the joint up to 140% from its original weakness, and it's been proven in experiments by Dr. Hackett and many others that prolotherapy really does work and PRP really does work, and it permanently strengthens the ligament, the tendon attachments, and can rebuild and repair cartilage. Now, this all does depend on how much damage is there. Sometimes it's only 50 or 60% successful if there's too much damage, but most of the time, it is worth a try, and people do see improvement unless there's some other pain generator going on that we're not getting a handle on. But it's always worth a try because it's such a successful therapy. Studies show that prolotherapy and PRP injections leave the joint stronger than the original joint that was damaged, and it provides more support and stability, and it lowers the potential of a future injury. There's 2 studies out of the Department of Orthopedic Surgery at the University of Iowa that were published in Journal of Orthopedic Research and in the Connective Tissue Research journals. These show that both ligaments and tendons can increase up to 40% in strength and size with this therapy, and exercise alone cannot do this. I've also seen this in my own research where I looked at low back pain patients. We did an ultrasound every week for 6 weeks after we did prolotherapy in their iliolumbar ligaments. And you could see that those ligaments were getting denser and just ever so slightly thicker every week up until about 5.5 weeks. And then at the 6th week, when we did the ultrasound again, you could see that it hadn't changed much more. And this correlates with the research that Dr. Hackett did in rabbits back in the 50s and 60s. So it really is a therapy that continues working for a while. With PRP, it may last longer than that. I myself had this done in my knee, and the PRP, I could feel it was still working to stabilize my joint and make it feel better up to about 3 months. So, PRP, let's talk about that. PRP stands for platelet rich plasma. This is blood plasma that's concentrated with platelets. If you look at the picture there on the slide, you can see that there's a centrifuge there. A centrifuge is used to take a vial of blood and you put that in there and it spins and spins and spins. We have a special centrifuge that spins it fast, slow, fast, slow. And in doing that, after about 15 minutes, you have the red blood cells all down at the bottom. And then at the top is the yellow fluid, which is the plasma. Now, at the bottom of that plasma, there's about a centimeter or so of fluid that's called platelet rich plasma. This is where all those platelets are concentrated. That's where all the growth factors are. And these growth factors can stimulate the tissue healing process at an accelerated rate. There is more information about the growth factors, all the different types that are in it and everything, and we'll give those to you in a PDF if you'd like it on our website. This is just a schematic picture here to illustrate to you what happens with the platelets. The activated platelets release growth factor proteins into the surrounding tissue. You can see we have our vial there with the separated blood, red blood cells at the bottom, plasma at the top. And then you see an electron microscopic picture next that shows the platelets floating. And then that last picture is the platelets exploding and opening up, and those little stringy things with a little ball on the end of them, those are growth factor proteins. And they're going out in the tissue as a signal to tell the body to heal that tissue wherever you've injected it. So, PRP treatment, often people will ask me, well, should I do PRP or prolotherapy? And it really is a personal choice. Usually, even if you have a mild problem, the PRP, you will need less injections, less, you know, continued treatments. Most patients, we say, need 2 to 3 of these treatments, but additional treatments might be required if you have a severe injury, an actual tear, maybe on the area of the body being treated, if it's something that you have to use a lot. The extent of damage is a big deciding factor. But often, if somebody's got a chronic problem, especially a bursitis, a tendonitis, a labral tear, labrum is a connective tissue cuff that goes around. There's one in the shoulder, there's one in the hip, and those are used for attachments for various muscles and other structures that keep the extremity on the body. Also, hamstring tendonitis or tears, shoulder and arm pain, ankle sprains, Achilles tendonitis is a really good one for PRP, headaches and neck pain, low back pain. Essentially, you can treat any area of pain that you think would respond to prolotherapy with PRP. But for sure, the more damage is there, or the more chronic it is, the PRP is going to work faster. And you're going to get those growth factors that you're not going to get with the prolotherapy. So, where does ozone fit into regenerative injections? Well, let me explain what ozone is first. Ozone's a colorless, unstable gas with a pungent odor and powerful oxidizing properties. This is formed from just medical grade oxygen, O2, and you expose it to electrical sparks in an ozone generator, and then it splits it into singlet oxygen. And when it comes back together, a lot of it comes back together as O3, and O3 is ozone. Prolozone and PRP with ozone is a technique that marries the concepts from regenerative injections and ozone therapy. It involves injecting ozone after you have done prolotherapy and PRP, or in some instances, you can do just ozone alone. We do it in paraspinal muscle injections, and that's been proven in studies to actually improve discogenic pain and reduce the need for pain medication. Also, I've done it a few times where I just inject it into a tendon with a chronic tendonitis, a very localized area of tendon pain and inflammation. And it's sometimes miraculous. Like you can see within a day or two, the pain is just gone. And the times that I've done it, the pain really has not come back. It's really kind of amazing. Ozone's basically anti-inflammatory and it does stimulate immune function and healing. So it can be additive or you can use it by itself. When we use it by itself, we have to use a fairly dense dose of it and it can burn. So we usually will numb the area first with like a lidocaine or something and then inject it. But there are minimally 13 proven effects of ozone. We have a handout on that. So if you'd like that, we can send it to you. It might also be on our website as well. But basically, the result is damaged tissues can be repaired and untreatable pain can be greatly improved or permanently cured. So, ozone inactivates a lot of human pathogens. You've got a bunch of bacteria, viruses, fungi, mold spores, fungal pathogens, also encysted protozoa like Giardia or Cryptosporidium. Those are parasites. All of these can be inactivated by ozone. So, ozone has this wonderful property of being an anti infective as well. We're not sure, but sometimes when people have chronic pain, we think maybe this might be part of it as well, helping the therapy work better and to decrease inflammation. So here's a slide where I just wanted to show you as a mad scientist, you can imagine that's me there. We take the ozone from a medical grade oxygen tank. We connect a hose up to our ozone generator, and then that generator throws these electric sparks at it. And it basically, depending on the speed of those sparks, it can make high dose or low dose ozone and again separates the oxygen into singlet oxygen, and then on the other end some of that forms back together as O3 or ozone. And ozone is just far more energetic and reactive than oxygen, which makes it super valuable for a lot of medical applications, air purification, water purification. They use that exclusively in Las Vegas for their water purification. I've also heard that in France they use it for water purification, and then the medical ozone therapies. One difference is that for air purification, basically those ozone generators kind of take the oxygen that's in the air that you're breathing, which isn't, medical grade 100% oxygen. When we use it for medical use, it's always made from 100% medical grade oxygen. And here I just wanted to show you a picture of your lovely practitioners, Dr. Auburn and Christy Taylor, PA. We like to have fun as well. We like to enjoy the holidays. And you can see that, we have positive spirit and we like to help people. We're going to be doing your injections here at the Natural Health Improvement Center. Christy's really good at it. She's been doing it for a few years now, and she's actually starting to teach it at our AOA PRM conferences. And I'm on their board, and I've been teaching for them for several years. Now let's talk about some other treatments at the Natural Health Improvement Center that we use to reduce pain and inflammation. The Hockett Ozone Sauna is a very unique tool that we use at the NHIC. We've seen lots of people get improvement in pain, inflammation, infection, and I've used it myself when my shoulders were really sore with tendonitis from doing a push-up challenge. Each session is 30 minutes long. It's very relaxing. It inactivates a lot of different pathogens, yeast, bacteria, viruses, etc. It speeds healing. It improves circulation. It detoxifies gently. It oxidizes toxins. It improves sports performance. It reduces inflammation and pain, and it calms the nerves. It really improves the parasympathetic rest and digest part of your nervous system so that you can heal more easily and feel better. It improves brain function as well. And it does it by several modalities. The modalities included in the ozone sauna are ozone therapy, of course. Far infrared is the heat source causing hyperthermia, but the heat is not that high of a temperature. Like a lot of your sweat saunas are, you know, about 125 to 140 degrees. This one really only has to go up to 104 degrees. And so you're not super duper hot, but that heat penetrates further into the tissue because it's far infrared. And then there's carbonic acid therapy. We have a carbon dioxide tank. When it's pumping into there, it combines with the steam and the water, and it becomes carbonic acid, which improves circulation, dilates blood vessels. Also, there's electrotherapy. You see the picture of the girl's legs there. She's got her feet on some metal plates. What you can't see is that she's also holding these two little metal bars in her hands. And electrotherapy is sending a certain wavelength of energy depending on what program you check. There's programs for anti-inflammatory, immune system. One of my favorites is transformation and healing. There's all kinds of electronic messages that can be sent, and they call that electrotherapy. It also has photon light therapy. In the picture with the legs there, you'll see there's two little round circles. Those are lights that put on a light show when you close the doors and turn on the machine. It actually flashes lots of different colors at different specified rates, and those have healing energy to them as well. And then there's aromatherapy. We can put any essential oil in there. There's a small well, which you can kind of see in that picture with the girl's feet. You put the oil in there, and then the steam and the heat get the essence of the oils throughout the machine and all over your body. Your head is, sticking out of this. And then we have towels around your head so that none of the ozone or any of the other contents really come out of the chamber. It's very comfortable. The seat can be changed to different heights so we can make you comfortable. And we have a whole list of essential oils so you can choose which one you want. We have a list of their properties so you can pick the one that you like the best. Now I'm going to talk about hyperbaric oxygen therapy. This is a chamber where you're placed in it, it's zipped up. There's windows. We give you a walkie-talkie. It's comfortable. It's spacious. It's 36 inches wide and 9 feet long, so you have plenty of room to move around. In the chamber, you could fit a small child and an adult. And you don't really want to move around a lot when you're in there. You can. it's pretty comfortable. And, you can take a nap, you can read your phone, you can take an iPad in there if you like. It's not like the hard chambers where the oxygen and the pressure is going to a much deeper level. In these, you can wear regular clothing and you can take your electronic devices in there. Once you're in the chamber, what happens is the atmospheric pressure is safely, slowly increased, and then more oxygen is forced into cells, triggering a cascade of healing mechanisms to improve neurological function, circulation, and healing. So when I think of HBOT, I think of healing a wound, whatever that wound is. It could be a brain wound from a stroke, it could be a wound from a torn tendon, it could be tendonitis in your shoulders. It could be that you just want to reduce the inflammation and stress in the body that's making your immune system not work as well. I'm doing it on a regular basis just for anti-aging purposes. I'm trying to make my cells younger and my mitochondria work better. And a lot of these things have been measured in hyperbaric oxygen therapy. It's even been shown to help along with other therapies you might do for cancer to help reduce the size of the tumors that a person has. So you can use it for that purpose as well. So it's used for chronic fatigue, viral illnesses. A lot of chronic Lyme patients use it. Any chronic degenerative disease, whether it's neurological or musculoskeletal or just some kind of inflammatory disease, would benefit from this. They say that one session in a hyperbaric chamber is like taking 800 milligrams of Motrin. Of course, the HBOT is a lot safer than Motrin or any medications. And our form of the HBOT is called mild HBOT. The reason it's called mild HBOT is because it only goes up to 1.3 atmospheres of pressure. It's a soft chamber, and that's as deep as we can go. And as we say, the dive, where the pressure, it's like diving down to about 14 feet or so in the water. But you don't have to go on a dive. You can just take a nice nap in the chamber, and the session lasts about an hour and it's very comfortable. It also helps, like the Hocket, to get your rest and digest parasympathetic nervous system working better, and it puts you in a healing state. And this is studied a lot over in Israel. There's huge chambers over there where they do lots and lots of experiments. The experiments that they've done with people who have had traumatic brain injuries from bombs or injuries, head injuries, and the like. They basically show that their accuracy and their cerebral mental function is better. And sometimes it's even better than when they were originally tested before they had their injury. And a lot of athletes will use this too to enhance sports performance. Basically, many elite athletes, basketball players, football players, tennis players, boxers, they do get injured because they push themselves a lot. And this basically helps their body to heal between their athletic performances. So this is really popular with athletes. So, additional therapies that we have here at the Natural Health Improvement Center to help pain include nutrition. We do nutrition consultations with people, put them on programs. We educate them about lifestyle changes, how to eat healthy food as opposed to those pro inflammatory foods that we talked about earlier. Also, we help people to lose weight, and then that gets into the detoxification programs. We have detox diets, we have detox programs that are either 10 days or 21 days that we tell people to do at least twice a year. We talk about sauna sweat programs that would include our Hocket. And we talk a lot about gastrointestinal health and integrative medicine, and also treat, the gut things that we talked about earlier. Detoxification should be done on a regular basis, and we individualize it to each one of our patients. And then the other big thing that we do here, if a person can do hormone therapy, this can be a huge anti-inflammatory. Also, hormones for both men and women. We know that it reduces dementia by somewhere between 60 and 75%. It reduces inflammation, it protects the heart, it protects the vasculature, it reduces musculoskeletal pain. I've seen people that had recurrent hip and shoulder bursitis after they went into menopause, and then when we started doing hormones, it just went away. It takes a few weeks, maybe a couple months, and people just feel better. They feel more alive. Their skin, their hair, their nails, their bones are all better for it. And again, these programs are individualized. Even if a person has had cancer in the past, many times if it's been long enough, they can do programs with hormones. There's very few people that actually cannot do hormones. We know that hormones are not the cause of cancer. There's been 3 studies over the last 20 years showing that you put people on hormones, and next to them, you put people on no hormones, and you follow them for 7 to 10 years, and there is really no difference in the rate of cancer. So I think other things are causing that cancer. There's some really good books about this. Estrogen Matters by Avram Bluming, and then also Smart Women Save Hormones. Also, Jonathan Wright has talked about hormones for men. I can't remember the name of his books right now, but he talks about all of the benefits of the hormones in men. And so this is something you really should consider if you're, over 50. My talk would not be complete without talking about acupuncture and our wonderful licensed acupuncturist and oriental medical doctor, Dr. Greg Flynn. He specializes in pain relief, allergy relief. He does natural allergy elimination technique. He does muscle balancing, smoking cessation, herbal medicine. He's an expert at that. He's studied ancient Chinese texts that have to do with all of this and applied kinesiology. So if we can't figure out which supplement is best for a person or if they're having troubles, if they're real sensitive, he can muscle test them with AK testing and see what works best for them. And studies do show that chronic low back pain, for that problem or any kind of pain, there is evidence of pain relief and functional improvement with acupuncture. It's also been used in patients who are going through chemotherapy and radiation. The pain from that or the nausea from that can be improved greatly with acupuncture. And we're so lucky, Dr. Flynn is not just an acupuncturist, he's an oriental medical doctor, so he knows a lot of different things. He can do many different things to improve pain or alleviate pain. And we have our physical therapy friends. I'm kind of picky about my physical therapists, and I like to know them personally. And I know the ones that really understand neuromuscular reeducation. Most of them know that I do prolotherapy and PRP injections here at the NHIC. And there's so many reasons to do physical therapy. A lot of people don't want to take the time for this, or their insurance will only give them a few sessions or something like this. But it's so worth it. And the people that do physical therapy, they are more prepared for their prolotherapy and PRP injections. Essentially, they've worked on their muscle imbalances, they've worked on their weaknesses, they've worked on their tight muscles. They have a home program that they're already doing. And if they're not completely better, then the prolotherapy and PRP or ozone injections can really take them the rest of the way. Sometimes people do the prolo and the PRP and the ozone, and then, just to get the body used to them being in a different state, a more stable state, they'll go to PT afterwards to finalize their program. But before, during, or after these injection therapies we do here, physical therapy is a great modality, and it improves your mood, your strength, cardiovascular status, muscle control, the neuromuscular imbalances. It decreases pain, and it gives them tools to use at home. It puts you more at cause over your condition. And, they give you programs to maintain your gains. And the people that I refer to in the area, they will always welcome you back if you're having trouble or you need more refinement. Supplements that I recommend to reduce pain and inflammation are a huge subject, but I'm just going to sort of summarize for you what you might want to think about for pain supplements if you need that in addition to everything else you're doing. Favorite supplements is MSM, methyl sulfonylureal methane. And a simpler way to put that is dietary sulfur. Yes, dietary sulfur is different than the sulfa antibiotics. So if you are allergic to sulfa antibiotics, you can do MSM. The MSM is just a very old, probably at least 30 years old, natural remedy for pain and inflammation. It's inexpensive. You can get it almost anywhere, especially health food stores. And it's got a huge dose range, 2,000 to 10,000 milligrams a day. And you just don't want to take that all at once, or it might be kind of hard on your gut. It has other properties, though, like it does bind onto toxins. It has a slight anti-inflammatory or anti-allergy type of effect. It can be combined with almost any of these other things on this page here. Quercetin is one we learned more about during our viral pandemic. It does act as an aquaphor so that your body can take zinc into your cells, but it in and of itself is a great anti-pain, anti-inflammatory supplement and an anti-allergy supplement. It's a bioflavonoid, and all the bioflavonoids are really good for your blood vessel walls. They make them stronger, but they also have that anti-allergy, antihistamine almost like effect, and they're definitely anti-inflammatory, anti-pain. A lot of my patients will combine these first two supplements, or they might take it along with turmeric or curcumin products. And as you can see here, we have several of those. Some of them just are made to absorb better, some of them are the whole plant versus just the root. Basically, sometimes what we have to do is just cycle through these different ones to find out what works best for our patients. And then we have Boswellia complex. Boswellia complex is actually Boswellia, turmeric, and curcumin all together, a powerful combination. And then there's Wobenzyme. Wobenzyme is a proteolytic enzyme product. It's got things like trypsin, chymotrypsin, other proteinases that you have to take this about an hour from food for it to work best. And this particular product came out of Germany. It was designed for musculoskeletal pain. There are other proteolytic enzymes that are available, and this is just one of them that we carry at our office. And then we have Salagesic. Salagesic is made from white willow bark. Now, this one is what aspirin is made from. So if you're already taking aspirin, you just want to be careful with it so that you're not taking too much, because it can, make the blood thin a little bit. So you might get more bruising more easily. You just have to watch and see how you do with it. But most people do quite well with this. I probably wouldn't do Salagesic long term, but it's more for those acute pain episodes. As long as your stomach is in good shape, you're probably fine with it. And then magnesium glycinate. Magnesium is incredible for relaxing the muscles. It's incredibly wonderful for your brain, your heart, your muscles, your connective tissue. It helps the bowels to move better. Just a great product. I like magnesium glycinate because it absorbs really well. Other forms that absorb well are magnesium taurate, magnesium lactate, and there's several others. What we don't want to use for pain and for inflammation and for relaxation of muscles or stress, we don't really want to use magnesium oxide, or we can use some magnesium citrate, but those forms, oxide and citrate, don't absorb as good. We do have one form that has a little bit of citrate mixed with glycinate and I think taurate, and we call that triple mag. That's a nice one. Magnesium supplements are very affordable. They help people with sleep, stress, anxiety, and those sorts of things too. So we use them a lot. Then we have topical relief with Tea Relief Homeopathic Gel. It contains arnica, but it contains several other homeopathics, and it can give you 2 to 4 hours of relief, and you can apply it several times a day if you want. There's also arnica, which we don't sell here, but you can get arnica, the homeopathic pellets that you can take orally as much as you want. You can combine it with anything, but you can get it at your local health food store. And then it wouldn't be really a complete list if I didn't mention fish oils. Fish oils are very anti-inflammatory once you get above about 1,200 milligrams per day. And some people, that's all they need to reduce their pain. So we do have a link for our natural pain relief handout on our website. You just go to the website, nhicwestmi.com, go to the About tab, click on Patient Resource Center, then click on Patient Handouts, and you'll see it there. Thank you very much for listening tonight. I hope you found some of this information helpful for any type of pain that you have. And if you do need help figuring it out, we're here for you. If you do have any comments or questions, please put those down below and we'll try to answer those within 1 to 2 days. If you would like a PDF of this presentation, and we'll have another one that has more of the scientific detailed data, we'll have that in a link on our Facebook page, YouTube, and on our website. You can easily access that. If you have any trouble finding any of this, or if there's any more information, or if you'd like to make an appointment at the Natural Health Improvement Center to see what we can do to improve your health or improve your pain, please call 616-301-0808. And thank you again for listening. Have a great evening. Bye now.